to articulate. Further, there is currently one critically ill case and one moderately ill case. The last time we spoke, we had 2 critically ill cases. I am assuming that one of those critically ill persons have been downgraded, if you will, to being moderately ill, and that is very positive. It means that the public health system is providing appropriate guidance and support, and that is encouraging. But we do have one person still critically ill, and we continue to provide service to and hope that that person will recover. In terms of testing, the island has seen a record number of tests over the last 24 hours. Our testing numbers are now up to 18,621, with 1,158 new samples tested in the last 24 hours. And this is significant. As you know, we took a decision the government that is, to further relax the persons coming in, both nationals and non-nationals. Nationals from the 1st of June, accelerated rate, and non-nationals since June 15th. And that resulted in quite a number of persons. So we have been able, the lab, the support team, to collect samples and to test. And over the last 24 hours, 1,558, which represents the largest number of results in any single day. And we want to commend the team for that. Of the 18,621 samples tested, in addition to the 638 positives, there are 17,926 negatives, and we have 57 cases that are pending. So that's it for the sort of main numbers. 12 new cases, 3 are local transmission, and the rest are from imports from the US and from Canada. Now, I raised the issue of the 3 local cases that I mentioned earlier. The 3 additional cases relate to an imported case because it's worth noting, and if you look at your screens, you will see the areas in the United States of America where, and the United Kingdom and Canada, where the persons coming in, the bulk of persons coming in, the majority of persons coming into our shores, they're originated from, both in terms of countries, but in terms of the U.S. states within the U.S. And our epidemiologist and her team decided to do an exercise in keeping with being as transparent as possible to give a breakdown of those 34 cases. 4 cases out of Canada, as I said earlier, 3 cases out of the United Kingdom. This is effective June 1 to June 16th, and 27 cases out of the United States of America. Of course, the bulk of persons coming in came out of the U.S., so we would have expected more from the U.S., but it is also interesting to look at where these persons originated from, because it gives an idea of where the risks may be greater. And the intention is to juxtapose that against some of the data coming out of these countries, and specifically the geographic location of these countries. And it confirms some of the statistics that we're getting in terms of our own nationals coming in. So in the case of New York, for example, 15 cases. That's where a number of Jamaicans reside. And of course, New York is still experiencing its own challenges. And in a sense that the New York area represents a slightly higher risk than some of the other states. The Florida is the next high number, 9 cases. And again, we have a very large community there. And in recent days, we have learned that cases in Florida have, there's a surge. In fact, over 3,000 cases reported in the last 24 hours. And then, of course, you have one cases in Arizona, Texas, and North Carolina. But New York and Florida, as expected, where most of our Jamaicans are, and where most have been coming in, that's where the risks seem to be represented most in terms of the positive cases. The other can I see the next slide? The breakout of those numbers are as you see them there in terms of age and sex distribution. Of the 37, we have an age cohort starting from 10 to 19 years, one, and the bulk of the numbers fall in the category of 30 to 59, with 30 to 39 representing the highest, but not very much higher than 40 to 49 and 50 to 59, 9 and 8 each, and of course 60 to 75 cases, and the male to female split is also represented on the slide. The next slide looks at the origins of, or the local origin, or the local addresses by parish, a breakout of the numbers here in Jamaica. And again, the St. Elizabeth represents St. Elizabeth, St. Catherine, and St. James represent the highest number, and KC, with Clarendon, Manchester, Westmoreland following suit, and then the lower numbers, 1 each, from Portland, Hanover, and St. Mary. This is just to give an indication that the virus, as relates to nationals, our nationals, it spans all parishes, so it's right across the country. It originates from particular states based on the population of Jamaicans living in those states, and it gives an indication as to perhaps how we will have to adjust the approach to managing the risk or the risk profile going forward. The other interesting note that I'd like to mention before we move forward is that we have discovered in the last 24 hours that for the first time, one imported case since June 1, testing at the airport, discovering that it was a positive case. That person was extracted from their home, and subsequent tests of the family members in that home revealed that there are 3 positive cases in that home, which would have been transmitted from the person who came in. Now, I raise this issue to suggest a couple of things. First of all, the stay-at-home order, which the Prime Minister and the rest of us have spoken about in the order, the latest order, is important for the protection of those individuals who come in, but it's also very important for those persons who reside in those settings. I know that you have a family member who comes in and they are going to be excited about seeing their loved ones. I know those persons here are going to be excited about seeing those individuals. But when we say you need to quarantine yourself, stay by yourself in a room, in a space, minimize the risk of contact until you get the test results, it is a very important directive. And this is a real live case of someone contaminating the rest of the household. And you know, the challenge with this is that one member who has been infected is the mother of the person who came in, who is an older person, and that could mean a higher risk profile, and the consequences, we hope not, but could be dire. And so it's important that that message be reinforced. Now, perhaps we need to push that message more from public health, and so we're going to have to self-reflect also and adjust the approach to ensure that takes place. Before we go into the discussion, I'm going to ask you to look at a video that hopefully places in further context what we're going to be discussing. We are in Montego Bay at the Donald Sangster International Airport, where today myself and Minister Bartlett, we saw non-nationals coming in, a number of them tourists, other non-nationals who are either here on long stay for work or otherwise. over 150 persons are involved in the processing, about 100 public health workers. The team from Western region, supported by other regions, have done very well. These flights coming in are considered high risk, coming from the US, so they are being tested. Samples are being collected, but generally speaking, persons are willing, are accepting of this in the interest of their own safety, but also in the safety and the interest of the Jamaican population. So thanks to the team as we continue to respond positively to the COVID threat that we face. Okay, thank you very much. So that was an indication, a brief overview of what is happening at Donald Sangster International Airport in Montego Bay, where myself and Minister Bartlett were present on Monday when we started to allow in non-nationals. And it was a successful day, I thought, and I want to just say thanks to the public health team, all the other agencies, the other ministries, tourism, foreign affairs, national security, transport, that really worked hard to make this, those efforts a success, and the efforts continue. All right, so much from me. I'd like to invite our guest celebrity host, Jamaican icon, Mr. Oliver Samuels, to take charge of the rest of the evening's proceedings, and it's about our vulnerable groups. It's a big area of focus for us. We've seen evidence of vulnerable groups being affected by COVID most adversely when compared to the rest of the population. And Oliver is going to help us to understand that by posing questions. You're free to send in your questions also, and we will try our best to respond. Oliver, over to you, sir. Welcome.
Thank you very much, Mr. Minister. Them say, uneasy lies the head that wears a crown. Me glad me are not in your position. But me not have a qualification or anything like that anyway. But I, moving around, everybody has been commending you and the ministry and the government in general for the work they have been doing in this pandemic. So we can only at this time hope that we can touch or stir the conscience of our citizens, that them continue to listen to what you have to say and obey, and we will continue to succeed. Now, there are two words that I want some explanation from. One is vulnerable and one is elderly, because I know some people don't like, nobody call them elderly, right? Senior citizen and all them sort of something. So I am going to ask the Chief Medical Officer first to describe what is a vulnerable group.
Thank you, Oliver. Well, first of all, when we talk about vulnerable, we're talking about being exposed to the possibility of harm. And so when we talk about vulnerable persons in this setting, the harm that we're looking at really is those persons that would be more likely to get severe illnesses. So it's the vulnerability of different groups of persons. For example, persons that are elderly, as you will get an explanation of later, as well as persons who have other illnesses that causes their immune system not to be functioning as a normal person. Their immune system is suppressed, so they're not able to respond. But aside from the vulnerable person, and we have identified those vulnerable persons based on what has happened across the world and what we have seen in our own population in terms of who it is that gets the more severe illnesses, so that we do see that it is, in fact, the persons that are elderly as well as the persons who have other illnesses. Also, though, we also have to talk about vulnerable settings, because we have vulnerable communities or vulnerable homes where the exposure to harm is that there is an increased possibility of spread. That is the harm to the community. So the community is vulnerable because there is a likelihood that you're going to have more persons becoming infected if the infection is in the community. Now, you can imagine that if you have the combination of the two, the vulnerable persons and the vulnerable setting, for example, in our infirmaries, or in our nursing homes, or even in our hospitals, if you have an outbreak, where you have elderly persons, you have persons with sicknesses, and then you have them all together, so the likelihood of spread is more. So you can have the vulnerable person, you can have the vulnerable community or the vulnerable setting, and then now if you combine them, where you have a lot of vulnerable persons in one setting, then there's an increased risk.
Very good. Thanks for that explanation. Vulnerable is a big word, you know. And, well, from what you have said, there is no, in relation to the vulnerable group, age has nothing really to do with that, because if somebody is vulnerable, like in the hospital setting, you can have young persons and older persons, elderly persons in the same setting, and so older people are vulnerable to this thing. Now, Professor, yes, it amused me because it's a long time here you come. How would you describe the elderly?
Both you and I.
Right.
Thank you very much, Oliver. Thank you, Minister and team. We define elderly several ways. We talk about age, so that's you and I.
Yes.
So that's anybody over 60. But we also talk about young elderly. That's why you hear government and minister talking about 65, 75. WHO will tell you about 80.
Yeah.
But very, very importantly, and I think this also speaks to CMOs, what CMOs said, for older people, we also talk about functional capacity. So you see, you are the young elderly because you're functionally able. But you can equally have somebody who is 63 or 64 who, because of arthritis, because of various issues, is bedridden or certainly frail, can't go up and down the steps. So whereas we need an age for the bureaucracy and for regulations, the elderly are a wide age group. Now I'm going to take issue with you. You said age doesn't have anything to do with it. Unfortunately, age has something to do with it. With the vulnerability. Because if you are 70 and you have been smoking for 40 years, or you've had your high blood pressure for 40 or 50 years, you are going to be more at risk than the person who has only done it for 20 years because of the insults and the damage that has been doing to your body. Imagine the cigarette smoking in the lungs. COVID affects the lungs. So if I have nice young lungs versus somebody who has been smoking, and smoking is still high among our males, older males, then you are going to have lungs that are not as efficient. Let me not say damaged, because the person may not know they're damaged.
Yeah.
Because they may be breathing fine. But that person is going to be more vulnerable. And this is something I'm not sure that everybody understands, because I got asked the question last week, but if my blood pressure and my diabetes is under control, then I'm not at risk. But you are at higher risk because you have had diabetes battering your blood vessels. So your blood vessel is not as efficient as the person that has not had diabetes. Similarly for hypertension. So when COVID gets in there and everything slows down, then you are going to have a more serious illness. Couple that with what CMO said. As you get older, your immune system is less efficient.
Yeah.
So you have a double whammy, you know. You are more at risk because your immune system, and it's because your immune system has done you well for 70 years. But the 70 years, every little cough and cold you get takes its toll. So the thing is, so you have an immune system. Don't you notice people who get flu, older people, take a lot longer than a young person to get better?
Yeah.
It's the same thing. So you have a double whammy. You have the immune system, so you are being not as efficient, so you are more at risk. Then you have these chronic diseases. 72% of the Jamaican population over 60 has at least one chronic disease. 72. You heard me?
Yes.
So
I
that's
want them to hear we.
I hope so.
I will.
Most of that is hypertension. 24% have diabetes. 12% have both hypertension and diabetes. Females, twice as more than men, and that's because they are overweight. There's a direct relationship to the obesity. So the point is, we know from the national survey that we have an older population with chronic disease. So government actually did the right thing to move quickly to make them stay at home and protect them.
That is that a Bible from Professor Shearer, you know. Yes? And folks, I should really hope that we are taking in this, because me, for example, I am vulnerable because I am over 60. And no matter how me look strong and hearty, right, I am vulnerable. So please, 60 and over, regard yourselves as vulnerable, no matter how strong and hearty you feel. Because me feel like a young bull, you know, but me vulnerable. Dr. Tufton, if persons over 70 are being told to stay home, how is the government helping them with living expenses?
Wow.
Because me not get nothing, you know. Me not get nothing.
Well, I must tell you, you have bowled me on that question. What I will say is that the Minister of Finance announced a very elaborate, very useful care package. You may have heard it, others would have heard it. He has quoted some stats. I don't have it offhand, but I know literally thousands, hundreds of thousands of persons have applied, where depending on your condition, Oliver, depending on your particular category, because it allows some support for small businesses, for individuals, and otherwise. And a number of persons have benefited from that package. And if you need further information, persons can visit the Ministry of Finance website. You could contact us. We can give some information. Beyond that, though, we fully appreciate and understand that asking persons to stay home is a challenge, especially if they are accustomed to going out. But of course, it's about how you manage the risk. The issue of food distribution is done by a number of agencies. The Ministry of Labor, for example, when we quarantine a community, we go in with a lot of packagings. Members of Parliament, political representatives, the private sector has been involved, and to the extent that someone is vulnerable and lacks basic amenities, we would certainly encourage them to get in touch with any of these ministries, Ministry of Labor certainly, but if it means talking to your public health official at the local health center or who visit the homes, then we'll be willing to give additional information as it relates to giving support.
You know, we're a funny set of people, you know. I know this lady, and she's been complaining that she don't get nothing. And she say, no, imagine my daughter-in-law, she go up on computer and she fill out application for me, and me no get nothing. And the girl run the corner, they say, who is my tenant? She do it pan her one and she get fair money, and me no get nothing. It's just amazing how people look at it, and enough people get and some no get. But I'm telling you, it is a great and brilliant, bold effort by the government for doing that. I'm going to try and ask the permanent secretary, which part in there? Not ready yet?
He's ready.
All right. In there, but he's not ready yet. So let me talk back to my favorite, Professor Shearer. What are the best ways to protect the vulnerable, especially those when living in a small setting?
Thank you. And before I answer that, let me add to the minister. The National Council for Senior Citizens will help the over 60, so they can call them as well, and they are in every parish. They have already done over 2,000 with the food packages. The most important way all of us can protect ourselves and others can protect their elderly is to avoid them coming in contact with the virus. Now, the way that you avoid them coming in contact with the virus is you keep them at home away from the virus. Now, the case that Minister spoke to of the person coming home and the mother getting infected is a classic example, because this is somebody in their 60s but she is in that age group, so the exposure. So the stay-at-home order is actually in the interest of older people. And remember, the stay-at-home order does allow you to come out once per day. It does allow you. We're not telling you not to pay your light bill because you can't go to the bank, because you and I know this is a set of people dealing in cash. So this is not a set of people with ABM card and credit cards. So that has been taken into consideration. So you can come out once per day.
Yes.
So, and most importantly, when you're coming out, the mask. And no, the mask is horrible, it is hot, etc. But it's going to save your life. Because if somebody is breathing on you, especially if you are in somewhere like a shop, I know of at least one case that the only place they went was the supermarket. So it's, yes, it's taxing, and we do have 20% that live alone. You talk about a small setting. Let's talk about the small setting where they are alone, and that is 20% of the population. You have to factor into that. If I am an older person living alone, I don't want nobody in my business. And I want my independence because that's all I have. I don't have any money. I don't have any job. And so it is about getting older people to accept that their life is more important than their independence, because they need the life to retain back that independence when we're not talking about COVID as much. So it's really about preventing exposure.
But is there a resistance though by older folks to this whole thing of wearing masks, washing hands and all, and not touch your face? And
Not anymore. Initially, we got a lot of pushback about the independence. One lady told us that she wanted to go and look at the meat in the supermarket because nobody can pick her meat for her. We're not seeing it as much, and we do have some information now from a survey that we're out there doing where there's not. But there is the loneliness that comes with it. There's an acceptance that this is in their own interest. This is a time, probably the first time since JADEP, that there's a concentration on protecting older people, and that is actually being received as we are now important. Somebody cares about us. So there's one group that is reluctant, and we need to remember them, but my message to them when they complain to me, and I get the complaints, is it's for your life. We do still have a set of persons, 65 to about 75, that are the major breadwinners. There was a lady on television saying you're not stopping her from vending. There are a couple of males that I know, and they are the source of income for 2 or 3 generations. So you work with them to work around if they're going into an office where they are alone, so that sort of thing. So it's really to work with them to see, can they don't want grandchildren knowing the banking information. So it's about working around that. But we don't want them hungry either. Mm-hmm. So it's a fine balance. So that one little group wants to know when it's going to be lifted. But the majority, and what we are getting in the feedback, and we're out in we're not in the field, we can't go in the field, so we're using a telephone, is that we accept it, we know we have to do it, and it is for our good. So the resistance, in fact, I suspect, Minister, you're going to have trouble getting them to come out after when you lift it.
Oh boy.
I want to ask the CMO if anybody over 70 ever get the virus, and if they ever recover.
I'm trying to see the numbers that we have here, but off the top of my head, what I do remember is that we have the over 60s, we've had up to 87 years old that have been affected, and over 60 to the 87, we've had about 50, a little bit more than 50 cases. The number of cases that we've had where persons have died, unfortunately, are mostly in that group, because we've had 5 persons out of that 50-odd persons that have passed, which is about a 10% mortality rate in that age group. So, that emphasizes that we have, within that age group, it is the highest mortality. And I just want to say that within that age group, the persons that died, these are the persons that had 2 or 3 or more comorbid illnesses. So between the 40 to the 59 age group, we've had just over 100 persons, 100 and a little bit, and we've had about 4 persons in that age group that have died, which works out to be about a 4% mortality rate. So definitely we are seeing that, and most of those persons in that 40 to 59 would have been higher up in that 40 to 59 group. So definitely we are seeing that. That's where we are seeing the more severe cases. But then the good side of it is that the rest of the persons, the five from 50 odd leaves 40 odd cases, have recovered and have done well. So the rest of the 4 out of the 100 and odd, the 90 odd, have recovered and have done well. So we do get recoveries, and many persons also are asymptomatic. They have no symptoms. They have been found through contact tracing. So it's not every elderly person is going to be sick, but it's just that the elderly person is more at risk because of all the things that Prof has spoken about of developing severe illnesses.
So my elderly people, we beg you to know, please adhere to what the Ministry of Health and the government is saying. Because, as I said before, no matter how we look strong and hearty, we are vulnerable. Stephen, you have anything for me?
Yes, we have some questions from our media partners. We're going to go to Brittany Clark from Nationwide.
Hello, good evening. Hi, good evening, everyone. Okay, so I have 2 questions. The first one, there have been some allegations of persons breaching the quarantine orders, especially while they await their test results for COVID-19. So what disciplinary actions have been taken against these persons, and how many of them have actually been sanctioned since the onset of COVID-19? And I have a follow-up after that one, please.
All right, so I am prepared to say that I am not convinced that all the instructions that have been given for persons coming in have been followed to a T. In fact, I've gotten a lot of anecdotal messages, about persons seeing persons in a store, at the wharf. They just came in and they have found their way to some form of gathering of one kind or another. I don't have hard evidence, but I do get the messages. And frankly speaking, I expect that there's going to be a margin of error there in terms of whether or not everyone complies, which is why we have a forum such as this one, because it's so important for us to say to persons who are coming in, persons who are going to accommodate those who are coming in, because as we have seen with this case I mentioned, one person came in, was awaiting the test results. It took 48 hours or thereabouts. Having discovered that they were positive, they were extracted and placed in an appropriate facility. But by then, they contaminated or passed on or infected 3 other persons within that household, including their mother, who is an older person, a vulnerable person, or a more vulnerable person. The truth is, Brittany, we can't, I don't think any particular government agency, whether it's the constabulary, the JDF, or the Ministry of Health, is going to be able to enforce these orders if Jamaicans, if all of us don't recognize that we have the primary responsibility of self-regulating, of obeying the orders in our own interests and in the interests of those around us, which is why we say everybody counts or everyone counts as part of the communication theme, because there are going to be persons who feel either because they think they're invincible, or they're just deviants, or they don't care, or they may think they have something to do that has to be done, who are going to breach the order. And unfortunately, we will get some of those. Now, there is a fine. I think it's $1 million, up to $1 million if you're caught, and 6 months or 6 months in prison. But again, we have not, I don't know of any person who has actually gone through that process. We have charged one person, but nowhere near the amount. What I would say is that we may have to, we are going to have to step up the enforcement and the vigilance to discourage it. But frankly speaking, Jamaicans will have to appreciate that they need to live within the order in their own interests and the interests of their family members and community.
Thank
The
you.
CMO wants.
Brittany, I just want to add that, while it is that we may not get around to charging people and charging them $100 million or whatever it is, 1 million, or put them in prison for 6 months, they have to realize that they're going to pay. Because when your elderly relative gets ill, and God forbid if that person should have a poor outcome, you're going to pay. It's not only you that are going to pay, but the rest of your community is going to pay when other persons become infected. And as a population, we're all going to pay, if it is that we have spread of disease and then we have to go back to the restrictions that we are trying to get away from. So everybody really has to take this seriously. It's not just about yourself. Every Jamaican has to be policing this.
Okay. Another question, Brittany, quickly.
Yes. Okay, so the follow-up is really on the topic of vulnerable groups. I just wanted to bring attention. There was a European study that linked blood groups to COVID-19 risks, and they're saying that pretty much a particular blood type A, is at a higher risk of developing severe COVID-19 disease. I just wanted to know if there has been any similar trend here in Jamaica, and are there any considerations to maybe add those persons to the category of vulnerable group? Thank you.
No. Thank you for that information, Brittany. We have not followed up on that. I have not heard this being discussed among the clinical team as yet, but I'm sure the interest has been sparked, and we will look into that.
Yeah, we're going to take one more from the media. We're going to go to Jamaica Social.
Hi, good evening. I'm Cassius Watson for Jamaica Social. My question is, judging by the figures that the minister just quoted, we're now up to 43, I believe, imported cases since June 1. With that in mind, and many more Jamaicans flooding in the next couple of weeks, months, are you now looking at extending your controlled reentry program, seeing that all we need is just really one person to start a major fire in Jamaica? Are you looking at extending so that you'll be able to monitor and manage persons at least for a couple more weeks or months?
All right, so the issue is really around risk and risk assessment, and that's an ongoing process. Obviously, the medical team here, led by the chief medical officer, assesses the clinical risk, the medical risk. A recommendation is made, but ultimately decisions are made at the level of cabinet and, of course, led by the Honorable Prime Minister. And so far, it has worked for us in terms of the decisions that we have taken, given the limited number of deaths, as unfortunate as each death is. That process will continue, so I can't say with any definitive position how we will proceed. What I will be able to say, though, is that in assessing the numbers, looking at the number of positive cases has to be done in the context of the overall numbers coming in. And the latest percentage I got from the epidemiologists earlier this evening is that of the number of nationals now that have come in since June 1 by airport, the number of positive cases are about 1.2%. Now, 1.2%, which means just over 1,000 or so persons would have come in. 1.2% is quite an encouraging stats in terms of positive rates. In other words, it says to us that we really have to go through a lot of testing, a lot of effort of testing, with all the associated resources associated with that, with the inconveniences associated with that, to pick up very few positives, even though you spoke to the 34. And the question that we will have to ask in the weeks and months ahead is how do we build out the infrastructure around surveillance, monitoring, treatment, and look at all the measures where testing becomes only one of several measures, and whether or not testing should continue and for how long. And I do envision, frankly speaking, that there's going to come a time when testing will not be a standard procedure for all coming in. Other forms of surveillance, certainly. There's always going to be surveillance, whether for COVID or otherwise, but testing may not be one of those. And I think for many reasons, both the risk as well as other reasons. So the answer to your question is we can't say no. It's a function of risk. It's a dynamic setting, but I'm sure changes will have to be made over time. And the numbers we have seen so far are not suggesting that they are so high that we have to filter every single person coming in. But that's a personal view for now until the team meets and discusses. Oliver, over to you again.
Now question to the Permanent Secretary. Let me see now to phrase this one. With all the passengers coming in and those that are expected to come in, because we know Jamaica is a very attractive place and no matter what, people want to come here. What is the cost per passenger for testing, including health staff and setup, etc.?
All right, so thank you very much. Thank you very much for that question. So the whole apparatus of taking persons back into the island has costed us significantly. And it has costed significantly because of the risk management that we have had to put in place to ensure that the population that is coming in does not impact the population that is here. And so the cost component has several elements to it. The cost of the operations at the airport, the cost to transport persons from the airport to holding facilities in the first instance, then the cost of testing of the thousands of people, nearly over 4,000 persons that have been tested from we started to take back persons in the island. So overall, the cost is elaborate. For example, the cost for hotel accommodation alone is around $670 million. When we look at all the different facilities that we have had to accommodate persons. The cost for the airport operations, if you look at the staff time and overtime that we have had, the personal protective equipment that we have had to, the tents that we have had to rent, all of those costs, we're running roughly $200 to $300 million there with that alone. Now, the cost for the test has several components in and of itself. So you have the cost for the actual swab. Then you have the cost. Then you have the cost for the reagents. Then you have the cost of the time on the machine. But then you also have the cost of the people who need to operate all of these things, the transportation of the specimen. All of these things are contributed. Now, the latest statistic says it's around $70 per test. When we look at all of the components of the cost, the value of the actual kit versus and all of the components part to it. So that is the cost per test. And now that we're doing everyone, the cost is elaborate. However, we must acknowledge the support of the organizations that have partnered with the government of Jamaica around this very, very expensive endeavor. The Pan American Health Organization, which is one of our main partners, the IAEA, which has come on board and provided test kits as well. We have test kits coming from our colleagues and our partners, the CDC. And of course, our colleagues and partners in the first instance, when we didn't have capacity at all, from the Caribbean Public Health Agency, CARFA. So, Yeah, I said CDC. So, I mean, all of these persons have allowed us to do what we're doing, and so we are very happy for that type of support. So right now, our running estimate for just all of this elaborate is about $1 billion.
Wow. That is a whole heap of money. The other question, which I personally don't like, but I'm asking because I want people to understand the minds of how some people are thinking, is to you again, sir, is why aren't these costs passed on to the travelers?
Because we're a generous people.
Give generous.
We're a generous people. So, as you know, we're policy driven, and the policy ethos from some time now, for some time now, has been that healthcare is free at the point of service delivery, and that policy position has therefore allowed the government to provide support to the same vulnerable population, but vulnerable in a different way. And so health provision in Jamaica, in its default position, is free at the point of service delivery. So that's a policy position. That's a policy anchor. I see the minister chomping at the bit to jump in. The other consideration, of course, is the fact that we have received so much support for testing from partners that those contributions from other governments, other taxpayers, and other jurisdictions have allowed us to provide these services to our Jamaican population.
If I may,
Go right ahead, Minister.
Mr. Chairman, I think it's important for Jamaicans to appreciate, in very simple but straightforward terms, that they are paying for these tests, ultimately. Part of the economic challenges that we face as a country right now, which is something we all have to grapple with in the months and years to come, is that resources that would have gone to roads and schools and other things, such things, have to be rechanneled for the public health response. And it's the right thing to do. And the government is committed to doing it. The Prime Minister has been very clear, and he's well supported by his cabinet members, and we've been doing it. Because this is a threat to our population. We need healthy people in order to have a productive people and to have a society where persons can live and feel good about themselves. But ultimately, the cost has to be borne, which is why the balancing lives with livelihood is such an important theme, and which is why the attempts at reopening to ensure that we begin economic activity is also necessary, because it is over time going to be important, and which is why, finally, and very importantly, we need to get Jamaicans to understand that the actions that they take, the personal responsibility that they assume in protecting themselves, in protecting their communities by wearing a masks, by social and physical distancing, by infection prevention and control, sanitization, the vulnerable communities that we're discussing, ensuring that they stay within a particular context, not overexpose themselves. All of these are intended to minimize the spread and by extension minimize the cost associated with cure and minimize the extent to which your tax dollars are going to be refocused to dealing with COVID as opposed to dealing with roads and water and other things. So I'm trying to make the connection, Oliver.
Yes.
And I think it's an important connection to make, despite the partnerships that we have had.
Well, see, you spoke about mask. Children have to wear mask, and that's for CMO. Are you?
Right. So the wearing of the mask is to provide a barrier, okay, for when you are in a situation where you can become exposed to droplets that are around you. And so therefore, in situations where you can't maintain physical distancing, it's important at this point that we do wear masks. And so, yes, it would apply to children because we do want to protect our children as well. But I think that we have to take it in context because we know that children won't tolerate the mask so well. The older ones probably will, but the younger ones probably won't. And And in all situations, you must weigh the benefit against the risk. And so therefore, if the child is not using the item properly and you cannot control any kind of problem that can occur, it would be best not to wear the mask. But again, weigh the benefit against the risk in every situation, because what you really do want to do is to offer the best protection for persons.
Thanks. Culturally, we love Jamaicans, especially the elderly. Also, elderly, senior citizen, elderly, all right. Stick to certain things like bush tea and all that. Is there any discovery of any of the bush teas that we drink? The sarsaparilla, the periwinkle, whatever, fever grass, soursop leaf, Jacquiline bush, all them kind of things.
Which one is that? The Jack in the bush? Which one is that? I
You don't know Jacquiline bush? Yes, man. So, any of those, anybody come up professing that any of these bushes help in the healing process?
Well, there's a lot of professions because certainly we hear all the reports that people believe that certain things will help, but at this point in time we don't have any sound evidence. And what we do know is that some of these items can be harmful, and so therefore we would not recommend that persons use these to try to attempt to keep away or to cure or treat COVID-19.
Okay, but you don't have any problem in them taking them like a bush tea? Because traditionally we do.
Well, I think, Oliver, if we think about well-being, some persons will have no sense of well-being if they don't have the little tea.
That's true. That is true. Okay. Now, Prof. My grandmother wants to go to church. It's her only way of socialization. What should I tell her to encourage her to stay home?
It's a big question, but I don't want you to tell her. I want you to go and share technology with her, and I want you to go to church with her on the laptop. So I want you to go. She has to go to church.
Yes.
But you're going to go to church at home. So you are going to go, and you're going to take your laptop, and you're going to find the different church services. You're going to find the one nearest to what she likes, especially with some singing and some clapham. And most importantly, you are going to sit there for the hour with her and go to church with her, because she would love the fact that you're going to church with her.
That is a brilliant, brilliant answer. You must have didn't know me. I'm going to ask you why you study that one, then you come back. You lick me with that one.
Because that one, Oliver, is a very common one. I mean, church is where a lot of older people socialize, not just for church, but you see them in the churchyards outside, etc. So they are really missing church, and they're missing the singing and their groups. And they're not on the phone quite as much as younger people, and they're certainly not on WhatsApp, etc. Yeah. So it's about replacing these activities, and most importantly, for one of the grannies to sit down with them while that is happening.
Can I just come in here, because
Yes,
the order
sir.
does allow persons to go to church, but there's a protocol. There's an issue of the size of the church, the spacing between persons, the physical distancing. And what we encourage the churches to do, and many have complied or have been complying, is doing the distancing that is required, the 6 feet apart, which would allow persons to minimize the risks associated with them, getting infected if someone were to have COVID. So there are different ways. Yes, there is the online, and that I know a lot of persons in practice, but it is true that the older population likes it's an important interaction, period.
So, Minister, when they go, they're not keeping the social distancing. So those of us that are dealing with them are pretending the order doesn't exist and suggesting they stay at home and wait for it. Because when they go, there's a lot of hugging and whatnot going on. Even though when they go in to sit down in the pews, they're sitting the 6. Once they go outside, They haven't seen these people for 3
Them
months. So especially for those, as CMO said, with 2 or more, we are suggesting they wait a little longer.
Minister, any special protocol for the vulnerable who has to go into government offices?
Thank you. The government has announced a series of measures, and the latest order reinforces these measures around work from home. There is the flexibility there, even though we have relaxed the work from home order to give persons the option now to go back to the central workspace. But companies, government or private, have the flexibility to work out an arrangement in order to get the job done. But if you can do that work from home, there's a flexibility to do that. And we certainly would encourage that to the extent that the work can get done while you have that separation, for the time being anyway. Beyond that, the ministry has put a number of protocols or approved a number of protocols that involves workplace infection prevention and control measures. So depending on the workplace, a BPO as opposed to another type of workplace, the hotels, for example, there are protocols that speaks to the mask wearing, the sanitizing stations, the separation in terms of physical distancing, the not come to work if you're sick, because to come when you're sick and coughing could mean spread. And so all of these things should apply, and we've been pushing that message, including now, and encouraging the HR departments, the human resource departments, to provide the training, provide the guidance, work with management. This is going to be absolutely essential. And certainly, as a vulnerable person, whether you have comorbidities or because of age, if you are in that context, you have to be particularly careful. And we have to reemphasize that.
I believe the question was saying, though, for persons, vulnerable persons who have to go in to do business in the government office, any protocol, because we know that we're not the most efficient. Government is not the most efficient institution in the world. And in spite of the fact that you're doing so fantastic, no for the government offices, them very, very, not chaka, but kind of, lax.
Yeah,
and old people going in there to get them business done, want to get in and get out quickly. And is there any special consideration?
Right, so not employees, no. These are clients, customers who are going. Yes. So to pay your taxes and that sort of thing. Got you. Yes, we do have protocols to deal with that. So if you notice, a number of entities have put spacing and a marker where people line up in terms of the 6 feet apart, and in terms of how many persons are allowed in a particular confined space at a particular time. I have to say to you, while I, as a government member myself, and I have to be self-critical, that it is true that sometimes we're not as efficient, but sometimes we are. I have to say to you, in recent times, I've seen pictures, whether on social media or otherwise, of government buildings and offices where persons waiting for service, and there's a crowd waiting, and it's not a good look, and it's not a public health, a good public health practice. And so you're absolutely spot on with that question. We have to encourage more persons to observe, in the case of waiting for services, the physical or distancing, the 6 feet apart. Look at the person in front of you, look at the person behind you, stretch your hand out. I don't know how long your hand is or mine, but maybe 2 arm length apart. The mask, especially the vulnerable, wear the mask when you're in that context, because you don't know who is who. It's as simple as that. And very importantly too, something we don't talk about a lot, to the extent that you can do or have someone help you to do things online. I know you have said, Professor Eldemire-Shearer, that some of the older folk don't want to share their PIN numbers with relatives or their bank account that we were talking of here. So that may be a challenge, but it may mean under the new norm that we have to share and trust someone. Because if you can stay home and do some of these transactions, Oliver, it may make sense to do it that way. I don't know if Prof wants to comment a little more on that.
I agree with you, Minister, but I also agree with Oliver. some of these lines are very long. And some of these old people can't stand in that hot sun for 3 and 4 hours. So I think if you, as a minister and as government, could appeal both to government offices and to private sector to take the older people out. But I'm one of them, and I've been with the special times. And when the crowd come down on you, you just get pushed out the way. So I think it's about creating a sensitivity that be sensitive to the older people and let them go ahead and not with 3-4 hours in lines. But
Steve,
yes, I think that the same comment that I said to Oliver, that you can have maybe not the PIN number, but a lot of online for the paying of bills, etc. That's another good grandmother, grandfather, grandchild interaction.
That's it. Stephen?
We have one more question from somebody on Zoom. We got Emma Lewis. Are you there?
Hi, yes, I'm here. Good evening, everyone. Good evening, Dr. Shearer. How are you?
I'm well, thank you, Emma. How are you?
Good. A quick question, something I asked about before, but I'd really love an update on the nursing homes, the private nursing homes, and the infirmaries. I know that inspections were going on, and I'd love to get an update on how that's going. Thank you.
I just want to say I can update in terms of the number of persons that we have interviewed and tested from the staff of the infirmaries. We have tested over 782 persons. We've only had one positive, which is a 0.1% positive rate there. So I just want to mention that this testing of the infirmary staff really gives us the best indication of what's happening in the population, because the staff from the infirmary comes from several different communities, and they are across a wide age group as well. And so it gives you an indication of what's happening in the population. And so having tested 782 of them with having only one positive, that's a very good indication of what's happening in the communities.
All right, thank you so much, Emma. CMO, this question here: do hospital treatments help with recovery, and does COVID just need to run its course, or does it need to run its course? Hospital medication help with it, or you just have to put people in a quarantine and then them stay there with food and thing, to boost them immune system thing. Is there medication that helps?
Right. So the treatment so far, first of all, most of the cases of COVID-19 are going to be without symptoms. And the ones that have symptoms, the most of those are going to be very mild symptoms, that they just need to stay at home, take some Panadol, some over-the-counter medications, and rest, drink a lot of fluids, and they will get over it. But for the cases that become moderately to severely ill, then they will need hospitalization so that they can be monitored carefully. Now, there's no specific treatment for COVID-19. And so, therefore, the treatment is going to be based on what is happening to the person. We know that this infection can cause severe infection in the lungs and cause difficulty in breathing. And so, therefore, there may be interventions that can only be had in the hospital for persons to get better. So in those situations, yes, hospital care is essential. And so for persons who are not doing so well, you may start off doing well and just have a little sore throat or a little fever, and you treat that. But if you find that your symptoms are getting worse, then you should get to a health facility so that you can be assessed and treated appropriately.
Thank you. There are some other questions on my list, but frankly, between the three of you, the four of you, you have answered all. So I don't want to go back to repeat. I want to use this time, this opportunity, to talk to my Jamaican people. Now, folks, me know that some of we very indisciplined. And in order to fight and win, we have to listen to the experts. Nobody tell me say, uno talk about say uno either wash your hand for a long time, so uno say why government tell you for wash your hand. Because a lot of us never used to wash our hand as often as we're doing it now. And it does help. Take all the precautions that you can and work alongside the government and Ministry of Health, because we are doing well out there in the world. People are respect we for the approach that the government has taken in combating or in fighting this pandemic. Another thing we must remember, we are opening up. People are coming into a country, a beautiful country. No make we get careless. You hear? Do not make we get careless. We do not know their status health-wise. No make we go lovey-dovey because we love hug up and we love kiss up and thing. No. Do the same foot thing, the hand thing. Make we keep it as is for now. And together, we are going to conquer. I want to thank you so much for having me here. Dr. Tufton, CMO, PS, Prof. Thank you. And I will now turn over this meeting to the great Minister Tufton.
Oliver, you have said it all. And first of all, I want to really thank you for being here on behalf of the public health team in Jamaica and indeed the government. You have tremendous influence based on your excellent contribution to culture and to society generally as a Jamaican icon, I call you. And just to reinforce the messaging, I think is really worth it and very important. So big up to you. As I say, Oliver, you're large, right? And continue to be large, and your name God abroad. So I hope those listening in the diaspora, many of whom will be coming home, whether Jamaicans or otherwise, appreciate the messaging that you are putting forward. And of course, Prof, as usual, you're a part of us, right? So yes. we don't need to consider you an outsider. You have done well, and you are the expert as it relates to aging and all the issues around aging. And, you know, I want to just close. So thank you for being here, and thank you for sharing. And you're going to always be here to help us in appreciating this challenge. Now, I want to close by saying that we're at a particular phase in this pandemic, in this national threat. I'm not the clinician here, but I'm well briefed by our epidemiologist and our CMO, and supported by the PS, where the government's approach to easing restrictions continues to increase, if you will, which means more Jamaicans and non-Jamaicans coming in, and which means that we are moving towards normalizing the flow, meaning persons who wish to travel can travel. We are an open society, but that comes with risks. And the approach to managing that risk is going to have to change over time, because when we were not allowing persons to come in because of an abundance of caution, and it was that approach was different and required a different set of management principles, or emphasizing more of one type than another. Over time, we will see the public health team refocusing and recalibrating, if you will, the approach and the strategy based on that risk assessment. Of course, we recommend, the government decides and implements. And part of the future is going to be observing those protocols, as Oliver said in his own way, the washing of hands, the sanitizing, the physical distancing, and part of that is, a big part of that is going to be surveillance, monitoring or surveillance. And that means deploying our newly recruited community health aides with the existing team in the field. It means identifying where persons are most vulnerable, which is what we have been trying to discuss today. The elderly, those with conditions, comorbidities, hypertension, diabetes, cancers, cardiovascular disease or heart disease, and those in prisons, in infirmaries, in nursing homes. Those are the areas that we will have to focus on. But even those who are young and healthy and strong, as was evidenced by the one person who came in at a 32-year-old, I believe, or a little over 30, who became positive and then infected his mother, who is 60 odd. All of us are at risk, and all of us, each of us can place someone else at risk and someone who is vulnerable. And therefore, everyone counts. We all have to play our part. So as we go forward, we'll be introducing new measures, de-emphasizing some, emphasizing some. Maybe less testing, more surveillance. Maybe more testing, managed surveillance. Maybe more testing in some groups, less in other groups. It's a dynamic, fluid situation that we're learning as we go along. But there is a playbook, because we have had pandemics before in the world. And what is important is that we all try to understand and try to stick to the instructions of the health authorities. Thank you very much for being with us. We appreciate the discussion. Thanks again, Oliver. Thank you very much, Prof. And of course, CMO and PS. Walk good until we talk again. God bless.
COVID-19